Well, my name is Allison Tabola, and I'm a physician with Trinity Mother Francis. I trained in family practice, and then I did an extra year in sports medicine, so I do non-surgical orthopedics primarily right now. I'm also one of the catechists at the cathedral, and I'm studying to get my master's in theology at the Augustine Institute in Denver as well. So I was asked here tonight to come talk about the first half of our talk, which is on love and fruitfulness. And at the end, I'll have my email address, so if you want copies of the handouts, just email me, because I have a lot of information on there for you guys, and some of it I'll skip over just as a matter of kind of saving time, but I definitely wanted it to be there for you guys to be able to read on your own. But we're gonna begin with a prayer. This is one of the books that I read in addition to Mary Healy's that they have for this class. Patrick Coffin wrote a book, Sex au Naturel, which is very good. Kimberly Hahn also wrote a book, Life-Giving Love, which is very good. But I'm going to borrow a prayer from Patrick Coffin, so we'll start with that. In the name of the Father, and the Son, and the Holy Spirit. O God, give us the grace to open our hearts to the Holy Spirit, to surrender our lives fully to you, and to live according to the plan for true happiness you have given us, made known to us through your church. Grant us humility where we have been proud, courage where we have been afraid, prudence where we have been brash, and repentance where we have been defiant. Help us to see marriage and the marital act as you intended, and to respect the sacredness of each and every human life. Amen. In the name of the Father, and the Son, and the Holy Spirit. So to begin this talk, this portion of the talk, I want first to kind of start that's on something that may seem a little unusual, but I want you to first imagine that you have someone close to you who comes to you for advice, and they want to start smoking, and they say, I want to start smoking, what do you think? So just think about what your advice would be and what you would say. I know personally I would tell them, absolutely don't start. It's a bad habit to break, but especially there's very serious and dangerous side effects with it. This is just a list. I'm not going to go over all of them, but these are some side effects of smoking. And you'll see my point in a minute about how this connects with the talk. So here's just a few. So you can see that if you smoke, your risk compared to someone who doesn't smoke for a lot of these things goes up significantly. Definitely the lung cancer and lung diseases, but also heart disease, stroke, vascular diseases. Very serious, some very serious issues with smoking. And my next question would be, is what does society tell us about smoking? So what does society say? That's kind of developed over the past several decades as to society's opinion, but currently some of the more recent ads are very, very dramatic, as you can see, to try to really discourage people from smoking. They look at the side effects and they say this is very dangerous, this is a big problem. We definitely should be discouraging people from smoking, and if they are smoking, try to find ways to help them stop. And I'm not going to go over these graphics in detail, but you can kind of see they kind of speak for themselves, but they're very dramatic. Now I want you to keep in mind what society says about smoking, and keep in mind the side effects of smoking, and then I want you to turn to this other drug that society actually doesn't hesitate to promote that has various side effects. Here's just a few. I'm not going to go over all of them. And so cancers, blood clots, strokes, heart attacks, these are significant, serious risks. But this drug is one the society does not even hesitate to promote, and encourages people to take this type of drug. And I'm going to come back to these side effects in a minute, but this drug that we're talking about is the hormonal contraceptives. The birth control pills is the most common form. And so society, despite these risks, is promoting this. And so you have to say, ask yourself, well, what's going on? And this is even so commonplace that if I say the pill, you automatically know that I'm talking about the birth control pill. You don't think Tylenol or Advil. You know automatically it's birth control pill. It's become that generic and that commonplace. And so why is it that this is happening? Well, these are some of the ads that you may see in society right now about different types of hormonal contraceptives. And to me, you'll see a radical difference between what society was saying about smoking compared to the hormonal contraceptives. These are just a few samples, but the top left, it's a vaginal ring, which is a hormonal contraceptive technique, and they're saying let freedom ring. The idea is that you're free from pills, but there's also this kind of underlying tone as if you're freeing yourself from something else. The bottom left this uh-oh idea. That's an emergency contraceptive pills. It kind of makes it seem like, oh, it's no big deal, quick fix, make a mistake, just quick, take 2 pills, you're good to go. It's just this very kind of idea that's very benign, no big deal. Top right is this idea where if you don't have a birth control plan, you're asexual and asocial and a-everything, as if you're not normal. And then the bottom right is pretty self-explanatory, but it's this idea of putting the church against women when the church is the biggest supporter of women. So this to me is just a dramatic difference between the way society is viewing these two types of agents. And so why is it being promoted with these horrible side effects? I think there's a lot of different reasons. For one, people are just misled and uninformed. They really don't know about the dangers. But also, when you look at different studies and research, there's a lot of bias that's out there. And so sometimes it makes it very challenging to interpret what these studies are really saying. But then also, I've heard many times people downplay the dangers for whatever reason. And I think we can go into this and have a huge discussion about why this is. But just for the sake of time, I want to kind of move on to another important point, is the culture. Our culture today, I think, is driving this. And John Paul II talks about how we have a culture of death because we just do not value the sacredness of human life and human dignity. And I think that's ultimately some of what's foundational in this problem. And I think if you look at the culture around and what it tells women, it says, if you want to be happy, if you want to have control of your life, if you want to avoid obstacles to success and to marriage, and if you want to be normal, then you take the pill. And it's just this common attitude about it. Kimberly Hahn even talks about in her book how that was right before getting married, her father sat down and said, okay, what pill are you going to take? Just this very common idea that it's just okay, it's just something that you do, it's just a normal thing every married couple should plan for. But our culture also seems to be really driven by success and power and achievement and selfishness. The culture also really fails to see the sacredness of human life. Just the fact that abortion is legal is evidence of this. And then the culture has this attitude that it's about me and my happiness, and I'll do whatever I have to achieve that, even if it means using people as objects. And then the final point is, I think the culture, we look for our happiness in the wrong places. We're looking for happiness in worldly pleasures and worldly things, and neglecting to see that the only place we're going to find true happiness is in God, and that God is showing us the way if we'll listen. And I think these are some of the things that are foundational in why we see what's happening. I want to go back to the side effects just to go over a few of these for just a minute. These are healthy women in general who are taking this drug. And these side effects that I'll show you are with any of the hormonal types. There's a lot of different types of birth control methods. Any of the ones that are hormonal are the ones that I'm going to be referring to in this next slide. And a little caveat, depends on the dose of the hormone and which hormones are present as to what side effects there will be. So the ones I'm going to list are with the most common, the combined hormonal pill that has the estrogen and progestin. So again, here are some of the side effects I'll just let you look over. And then I wanted to make a point about the breast cancer. For women, and the lifetime risk is 1 in 8 of getting breast cancer. For women who are on the combined hormonal contraceptive pills, that risk goes up. Now the studies vary, and some say 10%, some say 65%, and so it's a wide range as to how high that risk is, as to how high it goes up, but it's definitely an increased risk. Now some factors that play into it are age and how long you've been on the pill. So for example, women over 40, they have an increased risk of breast cancer being on the pill. Women who are under 40, they still have an increased risk in general, but especially if they've been on the pill for 4 years before their first pregnancy, their risk of breast cancer goes up. And there's also some studies that have found that over the past 30 years, there's been an increasing risk of the aggressive type of breast cancer, the ones where there's a 70% death rate in 5 years among women, young women. And so there's a lot of speculation as to why that is, and there's a lot of people wondering if the hormonal pills don't have a role to play, because these aggressive cancers play off the hormones. The hormones can make them be problematic. And so that's definitely something we have to be concerned about. And then additionally, blood clots, strokes, heart attacks, young women are definitely having these things happen. Young, healthy women who for no reason are developing blood clots, heart attacks, strokes, and there's a lot of cases where people have pinpointed the only thing that's putting them at risk is their hormonal contraceptive pills. So we know this is real, and some people will downplay how significant these risks are. But to me, we know that the risks are there and that's serious. Another thing that I think may raise your eyebrows a little bit is that this question: what does the pill, the combined hormonal contraceptive pill, have in common with arsenic, mustard gas, plutonium, asbestos, and tobacco? Because they have something in common. They're all listed by the World Health Organization as a Group 1 carcinogen. They're all in the same category. Now, there's a whole long list of things, but definitely the combined hormonal contraceptives are listed in this category because they absolutely cause cancer. So they're listed in this list, and you can find it online. So to me, when I read that, it was just shocking that that's out there and available, and it's because it's a known cancer-causing agent. So it should just kind of make you second-guess the use of these. But having said that, I mean, these are all very, very serious, but there's one additional thing that should definitely make people very concerned with the use of these hormonal contraceptive methods, because they all have the potential to result in an abortion. And I'm going to talk about how that is. Many people will argue that that risk is low, but in reality, you can't determine how low that risk is because there's no way we can do the appropriate trials and studies to find out. We know the risk is there because that's the way the hormones are intended to work. They'll claim the risk is low, and now they've even started to backtrack on that and say that there is no risk, but there's no data to back that up. But because the hormones are present, it's undeniable that is part of the purpose of how these hormonal contraceptives work. To kind of show you that, I don't want to give you a huge embryology talk, but this is kind of the development, a picture of the cycle and when someone becomes pregnant. So ovulation is when the ovary releases an egg. That happens every month during the women's cycle. Then you have fertilization, where if the egg unites with the sperm, fertilization happens and takes place. Then it will travel for 7 to 10 days down the fallopian tube, where it will implant on the uterus, and that's implantation. But from the moment of fertilization, those biological processes are starting. So the way that the hormonal contraceptives work is their primary method is to try to prevent ovulation. So their goal is to try to make ovulation not happen. But if that fails, then the next backup plan is to try to make the environment hostile for the sperm so that they will not fertilize the egg. But then if that fails, then the next step is to make the environment hostile in the uterus so that it won't implant. So it's a backup plan, is it so it won't implant. And when it doesn't implant, that's whenever you have the abortion happening. So if fertilization has occurred, and if the backup plan for the hormonal method is to make it not implant, then that's an abortion. And so we do know that theoretically that is one of the ways they're working. Now this is something I'll email you. It's just kind of a summary of what I talked about that you can look over in the handouts. So then the next question is we hear often people say these hormonal methods do not cause an abortion. I hear that all the time. Well, the reason for that is because groups have redefined when life begins. They say it does not happen at fertilization, it happens at implantation. That way you can say, well, the hormonal method doesn't affect implantation. Once it implants, the hormonal method doesn't work. Well, that's true. Once it implants, it doesn't have an effect. But for those 7 to 10 days, it can have an effect. So by redefining life and when life begins, you can say it doesn't cause an abortion, but that's not reality. This is going to be shocking, I think. These are some of the groups who have changed the definition of when life begins. So some states have. These are only 2 of many. Texas has not, thankfully. Texas still says it begins at fertilization. But the NIH is a big, they do a lot of research, the government, the FDA, this OBGYN group, so they've redefined it. So when they make statements about what happens, it's because they've redefined when life begins. So the reality, as I mentioned, conception is the moment of fertilization. So this is when all the biological processes are going. It's from that moment that the church teaches that that's when God infuses a soul into the person. So you have a new human person at that moment. And so, you know, that's been the teaching of the church forever. That's been the understanding medically until more in kind of more recent times, is this understanding of when conception happens at fertilization. Because from that moment, the biological processes are occurring, and the difference from the moment of fertilization until implantation is just different phases of maturation. So it's the difference from like an infant, child, teenager, adult. That's the same thing that's happening in the womb. It's just different phases of maturation, and so that's the reality behind the situation. So unfortunately, there's a lot of kind of misinformation out there. But I want to turn to the understanding of Christians and contraception real briefly as I kind of move into the talk a little bit more. Within the Christian community, for over 1900 years, all Christians prohibited birth control. There's no question, no doubt it was prohibited. And birth control is nothing new. You can read documents around 2000 BC where the Egyptians are even talking about how there's different devices and potions for birth control. Aristotle talks about different methods of birth control. The early church fathers, not all of them refer to it, but if they refer to it, they talk about different potions and devices, and they all prohibit it, all the church fathers. So for 1900 years, no question, prohibited. During the Reformation, prohibited. It wasn't until 1930 that this changed. In 1930, the Anglican Church had this conference, and they made the decision to allow birth control within marriage for grave reasons. They really didn't define exactly what this was. And so from that moment on, you start to see them allowing more and more and more exceptions over time as to what qualified as these grave reasons within marriage, within the Anglican Church. Then by 1958, they kind of got to the point where they said, well, we all just need to respect the consciences of the couple. If they've discerned they needed to use birth control, then it's allowed. And so it's this slippery slope where you start allowing it and then just continues to be allowed for more and more and more reasons. And then from that point on and throughout this time, you just see more and more Protestant groups start to allow it, to the point where today you just see widespread use among Christian groups. Although within the Catholic Church, it has been a firm view of the church that it's always been prohibited. And within the Catholic Church, in the same year as that Anglican decision, 1930s, Pope Pius XI, he wrote something called On Christian Marriage, a document on Christian marriage, and he clearly says contraception is intrinsically evil. And then in the 1950s and 60s, so about 20, 30 years later, what was happening in the world, you have different things happening. There's more and more widespread use of contraceptive methods. There's just the feminist movement, sexual revolution. A lot of things are starting to brew in society. And so they started to ask, many theologians started to say, well, is the church right in her views of prohibiting contraception? Maybe we should readdress this and see what really we should do. So Pope John the 23rd set up a commission to kind of evaluate this teaching on contraception. When he died, his successor Paul VI continued this commission. And what this was for about 3 years, you had various members of the church. There were clergy, theologians, lay people. They all met and were a part of this commission. And they, over 3 years, looked at the data, looked at the teachings of the church, looked at scripture and tradition and all their different sources, tried to determine what were the understanding of contraception. At the end of those 3 years, you had two groups that kind of came out of that. There was the majority opinion and the minority opinion. The majority opinion says, well, we think that the church should change her teachings. We think that contraception should be allowed. And they're influenced by various things to say that. Then the minority opinion says, well, not only should the church not change her teachings, the church can't change her teachings because this is God's law. This isn't a law of men where we have the right to change this. And so the commission submitted their advice and recommendations to the Pope. And so Pope Paul VI, at that point, reviewed their recommendations and their advice. And so then, guided by them and the Holy Spirit, he produced Humana Vitae in 1968. So 1968, Humana Vitae, definitely a must-read for Catholics. Basically, I'm just going to kind of summarize this document. It's very, very important, and much of the talk is going to kind of discuss this the rest of my time. But it's talking about how marriage and conjugal love are by their nature ordered to procreation and education of children, and also that each and every marital act must have a procreative and unitive meaning. So each and every marital act must be open to love and to life. If you do anything otherwise, it's frustrating God's design for marriage and the marital act. And if you deprive the marital act of even one of those meanings, you're acting in opposition to God's will. And so Humana Vitae clearly condemns contraception and sterilization. And so in this document, Paul VI also makes some predictions. He says that if contraception is allowed and practiced on a widespread level, then he predicted 4 major things would happen. And you'll see how right he was as we go through these. So this is 1968. So he says, if this is allowed, here's what will happen. You'll have increasing immorality. You'll have disrespect and objectification of women. You'll see eugenics and government abuse. And you'll see disrespect for the human body. And so I think just kind of thinking back what's happened since 1968, you can really see how he was very prophetic in many ways in this prediction. Now, some of the things that kind of point us in this direction to some proof of him being prophetic is just looking at some of the effects the pill has possibly had on society over the past 40 to 60 years or so. Now, these things that have been in society over the past 60 years or so: increasing divorce rate, increasing number of abortions, increasing number of sexually transmitted diseases, increasing number of sexually active teenagers, increasing teenage pregnancy rate, and then increasing percent of people having babies outside of marriage. So you have to ask yourself, is this a coincidence? Is this, the pill has been available during this time, so is there a coincidence? Well, many argue different things with it. Eric had given a talk on a couple weeks ago for this Theology of the Body that you can kind of go back and watch, because the second half he actually talks about this. And just for the sake of time and just not to be too repetitive, I'm not going to go over some of what he covered, but he did a really good job explaining how there are some other factors that play into this besides the pill and the hormonal contraceptives, but there definitely is a lot of concern that there is some relationship there. And with looking at Paul VI's predictions and looking at what has actually happened, I think there definitely is it plays a role in some of what's been happening. But he kind of goes into this a little bit more in detail. So kind of looking at the hormonal contraceptives, how they work, how they're intended to work, their side effects. I want to kind of look to see, well, why does the church view contraception as intrinsically evil? And hopefully to this point you can kind of see, well, in many ways it's unreasonable to use contraception in many ways, just because of the side effects, the dangers, the risks, the problems with it. So in many ways it's almost unreasonable. But the church says, well, yeah, they are dangerous, but this has nothing to do with why we teach that they're intrinsically evil. We think those dangers are probably a side effect because they are intrinsically evil. But the reasons the church says that hormonal contraceptives and contraceptive methods and sterilization and other things like that are intrinsically evil is because they violate the purpose and the nature of the marital act. And because of this, it violates the dignity of every human person. And so this is, to kind of explain this teaching of the church, we're going to kind of look at the marital act itself. And this is a lot of what the Theology of the Body by John Paul II does. It looks at the marital act and explains God's intentions for it. So the marital act, with the marital act, has an inseparable connection between the unitive and procreative meanings. So love and life. Always open to love and life. Every single marital act, every time the couple engages in the marital act, always open to love and life, union and procreation. And this is something that God's established. This isn't something man has defined. This is how God has defined the marital act, and it's the gift that He's given married couples to have this meaning and this purpose, is for love and life. And so Humana Vitae, it discusses this, and it really reflects a true understanding of the marital act. And it talks about how each and every marital act is to be open to love and life. And it makes it very explicit that contraception is intrinsically evil. And the reason for this is because contraception violates both unitive and procreative meanings of the marital act. And we're going to talk about that in more detail. But Humana Vitae is more than just saying, no, you can't can't use contraception. It's way more than that. Humana Vitae is a reflection on God's design for human love. It's a reflection on God's purpose for marriage and the marital act. And it really is showing that God designed sex to be a means to bless a marriage with the gift of a child. And that's the intention and the purpose. And what's happened is that we've misused it and abused it. But Humana Vitae also says that if you think about it, there is power in each and every marital act. The potential to create a new human person. And that's powerful. And so God allows us to participate with Him in an act of creation. So each time a child is conceived, we've been allowed by God to participate in creation. And even going a step further, if you think on a broader level, even the cosmos is changed. Every time conception happens, God has created and infused into that person a soul, an immortal soul, something that wasn't, now is, and will never pass out of existence because of that power of the conception. And so God allows us to participate, and He even creates a new immortal human soul that will never pass out of existence. So the entire cosmos is even changed. So there's power in that act. And Humana Vitae and the Church's teachings express that. And Humana Vitae and the Church's teachings also really emphasize the gift of a child. A child is always and only a blessing. They're never obstacles or burdens. They're never possessions. Children aren't necessarily rights or something that we're entitled to. They're always and only blessings from God. And they're priceless gifts. And if you think about it, children are souls placed in our care. And I mean, that's tremendous responsibility, but it's also tremendous gift and joy that God gives us. If you compare the Church's teachings now, keep these in mind, society has completely distorted views on marriage and children. You can see this in a few examples. Think about in high school. They have children carrying around a sack of flour or an egg or a doll that just cries all the time. That's completely separating the love and joy that comes with children. It's teaching them to fear this. It's teaching them to have a lot of negative feelings when it comes to the idea of having a child. And so we're really distorting even our children's views of what children are and the blessings that they are. Whenever society promotes birth control the way that it does, it's also teaching this idea that children are a burden or children are obstacles to success and obstacles to happiness. And then you can look at terminology, the terminology that society uses. So children are called accidents. People are told they fear pregnancy. Oh, I'm afraid of becoming pregnant. But what are we fearing? Because pregnancy is a natural result of the marital act. It means something's gone right, not that something's gone wrong. But we teach people to have these negative emotions and attitudes towards it. This idea of using protection. We also look at pregnancy as being a mistake. We talk about casual sex. And then society also talks about how birth control methods have failure rates. Well, failure rates, I mean, pregnancy means something's gone right. And so again, it's just showing the distorted views of society and really just some of it's ingraining these attitudes in us and even in our children. Sometimes you don't even realize some of the things that are happening. But to go back to what the Church says, the Church says that each and every child, there's always true love, they're amazing gifts from God, they're always blessings, and the Church emphasizes this. And the Church says, yes, I mean, children require sacrifice, but the blessings outweigh those sacrifices. The joy outweighs those, and God is going to give to that couple the graces they need, and if we just rely on God. To kind of explain a little bit more about reality and the Church's views on this, I want to kind of explain a little bit about natural law to kind of help explain why the Church says contraception is intrinsically evil. So I'm not going to spend a lot of time in explaining natural law, but just briefly, one of the ways to explain it is that the natural law explains the primary purpose and existence for something. So for example, why do we eat? So what's the primary purpose of food? The primary purpose of food is for nourishment. Now secondarily, you can have sources of pleasure. It can be a source of fellowship. It can be a source for celebration. But those are all secondary. I mean, the primary purpose for food is for nourishment. Now if someone decides they're going to fast or abstain from food, they're not abusing any of those purposes because they're not using the food. They're not abusing it because they're not using it. They're abstaining from it. So they're not violating the natural law by refraining from acting. But an example of violating the natural law, back in the time of the Roman Empire, they would sometimes have these feasts where they would eat and overindulge themselves because they were enjoying the fellowship and the pleasure. Then they would go to what were called vomitoriums. They would throw up so they could come back and overindulge and eat more. So now that's an example of violating the natural law, because the natural law is for nourishment. So if you violate that, you're thwarting the consequences. You're going against God's intended purpose for food. And so that's an example of how you can kind of understand the natural law. So you're enjoying the pleasures, which is a secondary reason, a secondary purpose for the food, and getting rid of the primary purpose. So now you can kind of see how that relates to the marital act. Primary purpose, the primary intention by God, is for union and procreation. And these are inseparable. And the secondary, it can be a source of pleasure. When you abstain from the marital act, you're not violating the natural law because you can't abuse it if you're not using it. And so you refrain. And there can be good reasons to do this, but it's not a violation. An example of violation, though, would be contraception, because what it's doing is it's going against the primary purpose. The primary purpose is union and procreation. Contraception is going against that, and I'll explain how in a minute. And it's reducing human sexuality to people merely seeking pleasure. It's really kind of just degrading the marital act for what it was primarily intended for. So to look at this, the procreative meaning, so does contraception violate this? Absolutely. Contraception is inherently anti-life. It is intended to prevent pregnancy and to prevent procreation from happening. And it's treating the good, the child, as undesirable, and you're deliberately trying to prevent that from happening. So the unitive meaning, does contraception violate this? Absolutely. So how? Well, whenever a couple vows to give themselves fully to each other in marriage, they say, I'm going to surrender everything I have to you, and they give that fully surrender themselves to each other. And so they promise to not withhold anything from the other so that their union can be complete. So the two become one flesh. And in order for that, you have to not withhold anything. So what is one thing that's being withheld when contraception is being done? Fertility is one thing. So you're definitely withholding your fertility. This is a great gift given to every human by God. And so if you withhold that, you are withholding something from your spouse. So that's just one thing. But I think you could also argue that you're holding back other things too. You're holding back complete trust and faith in God and in your spouse. You're holding back love, obedience to God, you're holding back selflessness. And marriage is between a man, a woman, and God. And so when you're holding anything back, you're violating that unitive meaning. And as John Paul II talks a lot about the language of the body and his theology of the body, I mean, you express some of the internal views that you hold and attitudes you hold in the way that you are with your body. And so by withholding anything, using contraception, putting up barriers or obstacles, preventing the unitive meaning from happening, it's speaking something opposite than what you promised. And then, husbands and wives are supposed to be signs of God's love for the world, signs of total self-giving. And as St. Paul talks about, the husband is to be Christ, giving all to his bride. And you can just look at the crucifix. I mean, that tells us what complete surrender is. And the woman is to receive that and then give back to her husband all that she has. And so anything less than complete surrender, you're falling short of God's design for marriage and the marital act. And you're violating the natural law. So you have to be open to love and life, every single marital act. And it's because of these things that contraception is intrinsically evil, because it's violating the natural law. God's primary purpose for the marital act, the unitive and procreative meanings, is being violated with contraception. Now, I'm not going to run through this slide other than just to say there's various types of methods, and all of them violate the natural law. And again, I can send you these slides so you can kind of read through that, because it goes through some other things too, in vitro fertilization and surrogate motherhood, and shows how those are violating the natural law as well. So briefly, I'm going to kind of introduce the topic of natural family planning, which the Todds are going to go into in more detail. But I wanted to bring this up with contraception just to compare them just briefly. So natural family planning, this is the practice of periodic abstinence during the fertile periods of a woman's menstrual cycle. And so what you're doing is taking advantage of God's design of the woman's fertility. And so when used properly, it doesn't violate the natural law. And the Todds are going to go into this a little bit more, but NFP is not necessarily needed, but there may be times, just through responsible parenting, the parents do discern that this is something that's necessary. And the Todds are going to go into this in more detail, but the church basically says that a couple must have just and serious reasons to practice natural family planning. But the church says that spacing children is morally neutral. It's not right or wrong. And the church says that as long as your intentions, as long as you're open to love and to life, and that marital act is not separated from those two things, then it's not violating the natural law. And again, I'm not going to go through that slide, but I can send it to you. So a lot of people have asked, well, how is natural family planning not just contraception? Well, there's objective differences. Contraception always works against the design that God has given the marital act, always works against it. So it's morally evil no matter what your motives are, no matter what the circumstances are. Contraception's morally evil. It's intrinsically evil. It acts against the fertility. It's closed to the unitive and procreative meanings of the marital act. With natural family planning, a couple is practicing periodic abstinence. And as we talked about, abstinence is morally neutral. It's not right or wrong. It's not an abuse of the natural law. And so it's not intrinsically evil at all. And you're not doing anything to physically prevent pregnancy during those periods of abstinence, or even when you are engaging in the marital act during the less fertile times, you're not doing anything to physically prevent pregnancy. And so you're always leaving open that possibility of life, no matter what. You're always saying, even during the less fertile times, God could still work. You're still leaving the marital act open to God and His will and His plan. So it doesn't separate the unitive procreative meanings at all. And so unitive, in natural family planning, the unitive meaning is present, because each and every act the couple is fully giving of themselves. They're holding nothing back. They're not holding their fertility back. They're holding absolutely nothing back. So that unitive meaning is there. The procreative meaning, each and every marital act is open to the possibility of new life. Even though you may engage in the marital act during the less fertile times, there's always that possibility of new life. There's been cases where spouses are engaging in the marital act during the fertile times, and they still become pregnant. So things can happen. There are instances where you can have an irregular ovulation or breakthrough ovulation, or just ovulate at a different time of the cycle. There's times where you can be irregular. So there's different possibilities. These things are uncommon, but you're at least leaving yourself open to that possibility. And if God intends and desires you to have a baby, you're open to that, even when you're engaging in the less fertile times. And the Todds will go into this even more, but that's the key, is you're always open to new life. And natural family planning is kind of making use of a natural disposition, whereas contraception is directly preventing that complete union and preventing procreation. And I'm not going to go into this last paragraph too much, but I just want to kind of make the note that your intentions can be wrong with natural family planning, which the Todds will go into more, but the actions themselves are not intrinsically evil, because you're not violating the natural law. But your intentions and motives can be wrong. And again, I'm going to let the Todds kind of go into that some more. But to kind of summarize some of what we've talked about these last 40 minutes or so, the church clearly says that no reason, however grave, can be put forward to make something that is intrinsically evil to be permissible. You're acting against the nature of something. So there's no way that something intrinsically evil can be good. And that's where contraception kind of falls into. So it's never lawful, even for the gravest reasons, to do evil that good may come of it. And contraception falls into that. Anything that deliberately frustrates the power of the marital act to generate life is a grave sin. And so in the church's teachings, what this is all reflecting, it's not trying to tell people to focus on the negatives and don't do this and don't do that. The church is really trying to help us to really see the beauty and the sacredness of every human life. It's saying that every single person is made in God's image. Every single life has value. An embryo in the fallopian tube, a fetus in the womb, the newborn, the infant, the young, the old, the virtuous or not, all human life is sacred. And this is what the church is really expressing whenever she's teaching what she does about contraception. The church is also teaching the sacredness of the marital act. The act has this inseparable unitive and procreative meanings. Anything done to prohibit either is a violation of the natural law, and so is intrinsically evil. And if you think about it, because life is so sacred, then the act that transmits that life is also sacred. And so God understands that, and the church expresses that in her teachings. And so contraception is basically saying no to God. You're closing yourself off to His will and His plan. And so the couple is really focusing more on enjoying the pleasures, and it's kind of destroying that natural purpose and the natural intention that God had for the marital act. And so contraception violates both unitive and procreative meanings, violates the natural law, frustrates God's design and plan for the marital act, and so you're acting in opposition by practicing this, in opposition to God's will. And then Humana Vitae comes and says the church's constant teaching regarding marriage and the marital act and children is to remind us that every life is sacred, the marital act is sacred. It reminds us of the power that each and every marital act has, and of the joy and blessings that come with the gift of children. And so each and every person must live as God calls us to live. We must be authentic witnesses in order to transform our culture. We need to transform this culture of death into a culture of life, which John Paul II talks a lot about. And John Paul II says, as the family goes, so goes the nation, and so goes the whole world in which we live. And I think this starts with a man and a woman living their vocation of marriage authentically and faithfully in every way. And this is really, I think, at the heart of what the church is teaching, is that in order to transform the world, we start with ourselves and start with our family, and the church is only showing us, this path to true happiness, which is God. And so I think it's really important for us to understand what the church teaches and why she teaches what she does, so that we can live as faithfully and authentically as possible. So that's going to finish up my half, and I'll let the Todds do their portion. But if you wanted to contact me, this is my email. If you have any questions afterwards, I'd be more than happy to stay as long as I need to answer them as best as I can. And then I'll definitely email you the slides, because I think that there's a lot of information I put on here thinking that y'all might have the slides. But I have some church documents that I think are very important to read on this topic. I have some books that I would recommend on this topic. There's some websites. And I put on here some different things about birth control, but also just church teaching, and then some specific articles about contraception and the morning after pill and things like that. And then there's some biblical references where the Bible really talks to us, about birth control. And there's some fascinating examples, I think, that where the Bible is pretty clear in what it teaches. And then just some samples of church fathers. All the church fathers who talked about birth control condemned it, and I put 2 quotes on here from Augustine, who makes it very clear what the church's teaching is. And so that's the...
Okay, so Adam and Jody Todd, we're going to focus a little bit more on responsible parenthood. So it's sort of the practical application of some of the higher level stuff that was being talked about before. And so our talk in general is on responsible parenthood and natural family planning. So real quick before we get started, Gallup poll. How many of you want your marriages to last a lifetime, 20 years, 10 years, 10 months?
10 months? Any takers?
Anybody? How many of you might be willing to do something in the future you're not doing today to help your marriage? Sound like a decent idea? Okay, yeah. The experience of many couples, happy and healthy marriages, divorce is less common, better communication, and mutual respect. These are all things that using natural family planning provide to a marriage, or these are benefits of using natural family planning in marriage. So our purpose here today is to provide information on what NFP is and what NFP is not, to discuss responsible parenthood, to answer questions and to motivate you to learn more about NFP and try it yourselves. We're not going to really get into a lot of the details of NFP today because we just don't have time. We do a course that we offer several times throughout the course of the year. That's 3-hour courses where we really get into teaching the method, and we review the charting and actually go into a lot of detail with people. And so if that's something that you're interested in, we'll give you more information about it after the class. But this is kind of a summary of what we're going to be going over. So Jody's going to start by talking about NFP and the science behind it. I'll talk about methods and effectiveness. Then Jody will talk about contraceptives, and we'll try not to overlap too much. And then we'll both talk a little bit about church teaching and responsible parenthood, and that will hopefully be the bulk of the conversation.
So where are we now? We're going to talk about NFP and the science behind it. What is NFP? NFP is basically fertility awareness, being aware of the couple's fertility together and how it operates. You become aware of how to read the body's signs of infertility and fertility, and it's over 99% effective. And now that statistic is referring to postponing pregnancy, but as you'll see, it's also very effective in helping people to achieve pregnancy. So what is NFP not? So I'm sure you all have heard some things about NFP. NFP is not contraception, and I thought Allison did a great job of explaining why it's not contraception. NFP is also not the rhythm method, okay? Who knows good old calendar rhythm method, count your days, and I think it's kind of in here, and we'll guess. You know, that's the rhythm method, okay? So it's not the rhythm method. A woman has a menstrual cycle, and her menstrual, this is the clicking, can y'all see the laser? Okay, so the menstrual cycle starts at menstruation. You can see kind of this red area over here. It starts at menstruation, and usually from the beginning of menstruation for about 10 days, she has kind of an infertile period. And then usually she sees her first sign of fertility, and then she has a period of about 7 to 10 days that's considered the fertile window. During that time, she's going to ovulate. Ovulation is usually going to last for about 24 hours. And then there's a period after that that's about 10 to 14 days where she's going to also be considered infertile. So you can see that about 2/3 of the cycle, we're talking about an average cycle for a woman who's having a 28 to 30-day cycle, is considered infertile. So how NFP works is it measures the changes in the signs of the fertility. It's actually scientific. You're not basing it on a guessing at when most cycles are, because if you're a woman that has kind of an irregular cycle, like I'm that kind of woman, I don't have any regular cycles. So that can be really confusing. So you actually look at the signs of fertility and apply rules, and you apply those rules in such a way that you know when you're fertile. You record it on a chart to define fertility and infertility, and Adam actually does all our charting. He's the chart guy. And then you abstain or have relations based on absence or presence of fertile signs. So if your desire is to postpone, then you would abstain during the fertile time. And if you want to achieve pregnancy, then you would have intercourse during the fertile time. Conception. This can only happen for about 6 to 7 days during a woman's cycle. So only about 6 to 7 days when you can actually conceive a baby each cycle. This 6 to 7 days is near the time of ovulation. You remember that kind of green part on the pie. And the egg life, like I said, is about 24 hours. The sperm life is about 3 to 5 days, kind of based upon how fertile a woman's mucus is. And then combined, that gives us the 6 to 7 day window. So this is kind of showing the probability of conception. So if you kind of look over here, starting on, about 5 days out, it's pretty low chances that she would conceive. And then as she becomes more fertile and coming into ovulation, that chance goes up pretty high over there. And then after she ovulates, it drops back down pretty drastically. So do y'all all kind of understand how NFP works, basically, sort of ish? Okay. Methods.
Okay. Pushing that button, yeah. Okay, so let's talk about NFP methods. So there's several different methods. The one that we practice and teach is called the symptothermal method, and it's done through the Couple-to-Couple League. And you can see kind of down here that the CCL is Couple-to-Couple League. There's other groups that teach a similar symptothermal method. Several of the more popular methods are also what we call mucus only, and so we're specifically looking at the mucus sign to base their chart on. And Billings and Creighton are probably the two most popular of those. Did you want to say anything about Billings or Creighton? Okay. And then another one that's become a little bit more popular probably in the last, 10, 15 years or so is this Marquette model over here. That's making use of one of the fertility monitors. And the fertility monitors are sold, they're marketed to help people that are having trouble ovulating or having trouble conceiving to find the prime time to be able to conceive. And there's actually the Marquette method is a model built around using that monitor to identify the fertile time and also use that as a method of NFP. So there's several different ways that you can practice it. Like we said, we teach CCL. We have another teacher in our diocese that does Billings, and she's also, I think, Creighton trained as well. So we have lots of different resources available for different people, but we prefer CCL, the symptothermal method, because it gives you a lot of cross checks. There's a lot of balances and what's that?
More information.
More information that you can look at. So NFP is also something per the Marquette method, and then in any of the methods really, you can use to achieve pregnancy. Fertility awareness can help couples conceive in half the time or less. And knowing how to identify the fertile window is very key. So, I mean, you can imagine when Jody showed you the sign there of the menstrual cycle and being able to identify those fertile days, and then looking at the likelihood of conception when you engage in the marital act in one of those particular days, you can really hone it into a science, and it really helps people that haven't been able to conceive maybe be able to conceive. So we use it for both ways, and I think that's really important to this attitude of being open to life. So Jody mentioned this before. Is it the rhythm method? The rhythm method was calendar-based exclusively. It assumed that you had a regular cycle, and it assumed basically that every one of your cycles was going to look identical. Obviously, that would be problematic for irregular cycles, and irregular cycles are actually a normal event for any woman. So it's not, some women may be more regular, but every woman from time to time is going to have an irregular cycle, maybe because of stress, because of circumstances in their life, sickness, different things like that can cause irregular cycles. And calendar rhythm method is a challenge in times like that. Natural family planning is based on signs of fertility. So you're actually, your fertility and the hormones that your body releases when it's fertile cause certain things to happen in your body. And so natural family planning is using those signs to be able to more specifically identify when you're fertile and when you're not. Okay. Any questions about that? No. We're not going to get into a lot of detail on this, but this is an example of a symptothermal chart. And so the point of us showing this is just to kind of say, look at all the different cross-checks we've got. Down here at the bottom, you can see this is an indication of what the mucus signs looked like. This is a temperature recording, and we're taking all of those signs in conjunction with each other. We know how many charts the person has. We know the day of the day bleeding started here and here. And there's just so many different things that you can look at to cross-check and identify that you can really hone it in and get pretty accurate with it. So that leads us into effectiveness, the effectiveness of the symptothermal method, and then the Creighton method on here. So method effectiveness versus user effectiveness. The method effectiveness is if we use the method perfectly every single time, how effective is it? User effectiveness is if the user is trained on it, and they may make mistakes, they may not, but that's how effective a trained user is, even if they do make an occasional mistake. So symptothermal method, there have been a couple of different studies. Basically, the most recent study shows that it's 99.6% effective on method effectiveness and still 98% effective on user effectiveness. Creighton was similar, and the older study on symptothermal method showed that as well. So what you can see here is that it's extremely effective, and what we'll see on the next slide here, and this is a really interesting slide, this compares NFP to other contraceptives in their effectiveness. So you can see here that a lot of the kind of consider more primitive, older methods of contraception are actually less effective than NFP. There are a few that are still equally effective, but there's an argument out there. There's an opinion out there among people that, well, natural family planning, there are a lot of errors with it. I think we cut some of the slides out from the presentation for time, but there were some quotes from WebMD that said that it's basically that it's not very effective, that there are a lot of errors with it. If you know how to do it, you study it, and you actually learn the method, it can be extremely effective. So don't let that be something that scares you.
So right now we're kind of talking about NFP and comparing it to contraceptives and effectiveness. So we're kind of focusing on using NFP to postpone a pregnancy. But of course we don't want to emphasize that anyone should do that or make a judgment call about reasons for that, and we'll explain more about that later. We're just trying to show you why NFP is effective and why you don't have to have 100 babies if you choose to get off the pill. So let's talk about contraceptives. The categories of contraception are hormonal, which Allison talked a lot about hormonal contraceptives. There's obviously barrier methods that would be like condoms or a diaphragm, IUDs, and sterilization. We talked a lot about contraceptive actions. They suppress ovulation, they thicken the cervical mucus, and they slow tubal motility. And then we talked a little bit about that this is kind of has an abortifacient effect. By thinning the uterine lining, it can prevent conception. Now, I know many, many women who, if they understood this about the pill that they were on, would just be horrified that they could be aborting their new baby. Breakthrough ovulation is not infrequent. Who knows someone who has gotten pregnant on the pill? Do you know anyone who's ever gotten pregnant while taking the pill? It happens all the time. So you can kind of understand if you're getting pregnant on the pill, how many times are you getting pregnant but not actually having implantation occur? We don't really know. That was kind of Allison's point. We just don't know. So it's very serious, the side effects of this. And I also want to mention that IUDs now, the intrauterine devices, are also giving hormonal contraceptives into the uterus. They're just doing it all the time. So this is like even coming into IUDs now. Obviously, Allison spent a lot of time on this, but of the women in the U.S. who discontinued hormonal contraceptives, how many did so because of the negative side effects? What do you think? 33, 43? 64% did so because of the negative side effects. So we are making ourselves miserable. I mean, very unhappy on this pill. These are just listing some of the, adverse side effects, the negative things. Obviously, we have listed. Sorry. Don't ask me to do anything with technology. with hormonal contraceptives, there's cancers, depression. Lots of people talk about mood swings and things like that, blood clots, stroke. Over here in barriers, allergies, bladder infections, toxic shock syndrome. Down here in the IUDs, we're talking about infertility. You can make yourself permanently infertile, ectopic pregnancy, more menstrual bleeding, uterine perforation. It can poke a hole. It's just awful. Sterilization, we have in tubal ligations, there's obviously surgical risk. You're doing a surgery. Pelvic pain, hysterectomy, and a lot of people feel a lot of regret after they have been sterilized. Vasectomies, we have, just decreased libido, testicular pain. I read a study recently that was talking about an increase of prostate cancer related to vasectomies. So, there's just, you're messing with a body's natural functioning system, and so it's going to have side effects. So where are we now? How and when to apply all this great knowledge that you guys are getting?
Okay, so this is kind of the section where I feel like we sort of bring this all together. Allison did a really good job talking about the theology and a lot of the science. We've sort of talked in a little bit more specifics about the science behind natural family planning, effectiveness, that it can work. And so responsible parenthood is how we kind of bring all this stuff together. And we want to start by taking a look here at the commitment that we made at the altar when we got married. We vowed, part of our marital vow was that we would love free, totally, faithfully, and fruitfully. The priest at the altar asked you, have you come here freely to give yourselves of each other without reservation? So you see freely and you see without reservation. That's free and total. You said, I do. The man and woman said, I do. Said, do you promise to be faithful until death? That's faithful. You said, I do. And then finally, do you promise to receive children lovingly from God? And obviously that's fruitful, and you would have said, I do. So the church doesn't mince words here. It's right out there in front of everybody for us to see. It's in the sacrament itself. It's in the ceremony itself that we will be open to life, that this is the purpose, this is one of the primary purposes for our marriage. So how does this play out in our day-to-day lives? A Catholic Christian marriage is, I kind of like to use the analogy of, it's sort of a love song that we sing day to day to each other in and out of our relationship. We kind of wake up, we roll out of bed, we make breakfast, change diapers, we're telling each other we love each other, we are, we give each other a hug, maybe go to work, maybe stay home and watch the kids. There's, we spend the entire day in service of the other person, always with this attitude of generosity, always with this attitude of dying to yourself for the betterment of the other person. That's sort of this attitude of what Christian marriage is about. Then we come home, we reunite. The house may be still kind of crazy. We're making dinner, we're bathing kids, we're getting ready for bed. Hopefully we pray together. We maybe spend a little bit of time together. And then after all that hustle and bustle of the day, we come together, and the whole day again has been this act of generosity to the other person, in theory. We try our best to make the day this act of generosity. And at the end of the day, the love song culminates, and we have to discern with each other how our vow of fruitfulness is going to be manifesting itself that day. At that moment, we have to remember that our marriage is a living image of the Holy Trinity. Okay, and this picture is a really beautiful kind of example of it's called the Two Trinities, and you can see where they're sort of juxtaposing the Holy Family down here at the bottom with the three persons of the Trinity vertically there. And so one of the main central themes of the theology of the body is for us to be able to see that the Father, Son, and the Holy Spirit are imaged or reflected in the people of a marriage, husband, wife, and in the marital embrace, the possibility of that new life, right? So the husband as the father, wife as the son, and the possibility of that new life images the Holy Spirit. And so by removing that new life from the marital act, or the possibility of that new life from the marital act, in a lot of ways we're not completing the Trinity. We're basically telling the Holy Spirit we'd rather not have you in the equation right now. So responsible parenthood comes full circle in this picture, in that image. The marital embrace is the closest a married couple will ever come in this life to understanding the Trinity, to understanding that mystery that we can't understand, but that's as close as we get in this life to getting it. What an incredible gift God's given us, right? We have the ability, we talked about being able to participate in creation. That's another tremendous gift that God has given us, but all of it revolves around that act, but not violating it by making it not open to life. And so we're participating in one of the most intimate symbols that God will ever know, intimate symbols of God that we will ever know in this life. Yeah. So responsible parenthood is an informed decision by a married couple to try to conceive a child or postpone according to their circumstances. Another way to say that is it's a virtuous application of fertility awareness. So fertility awareness, again, that's the knowledge that we're using. The knowledge of whether we're fertile or not, whether we're able to conceive or not. And natural family planning or responsible parenthood is using that knowledge in a way that's consistent with that discernment process that we have to go through day in and day out as a married couple. And so the question at the bottom here, does the church require couples to have as many children as possible? So, yeah.
Absolutely. Yes. Okay.
Yeah. So the answer to that is no. But what we are called to is generosity. I talked earlier about the husband and wife being generous in their love to each other day to day, and that generosity overflows into that discernment process and into the marital act and the possibility of creating new life. And so we need to be generous as we discern this, and some classic or some typical examples of things that we would reasons that we might choose to postpone or delay are physical, economic, psychological, or social conditions. So just who can give me an example of something that might be a physical condition that would cause somebody to that you would need to discern seriously whether or not to conceive? Anybody think of an example there? I'm sorry? Sickness.
A woman's
Absolutely.
health, things like that, yeah.
Yep.
Okay, economic.
So some economic examples, obviously if there's maybe a loss of a job or trying to think of, is there another good example that I had?
Just
okay.
Maternity insurance or
right.
something like
Insurance
that.
is another one
There's
that's
lots of
possible.
things
Different things. Psychological, this is one that's really important. The sanity of mom. If mom's at home with the kids, I think spacing the kids becomes very important for that, and then just also The social conditions is another one. So the number of kids in the household, how that dynamic plays out. There might be a major social issue like what's going on in China, where it may be dangerous to have a child, and that may be an issue to maybe discern to limit pregnancy. And so the point is that whenever we're called to limit family size, NFP is the way to do that. NFP is the accepted method that the church gives us to do that. And the main reason for that is that we're working with our bodies, with the design that God gave us, and not against it. That cycle that Jody showed the picture of at the beginning, that's a cycle as a gift from God that allows us to have that creative space to work within. And it allows us to be responsible in the way that we choose to plan our family. And so we're working with it and not against it.
Oh. Okay. So one thing I just want to talk about really fast before I move on to this slide is that I think it is really important to distinguish that when we get married, we still have to be chaste in the marriage. It's not a free-for-all. It's not like even if you waited to have intercourse till you got married, it's not like all of a sudden then the chains break off and it's just whatever you want goes and everything. There's still a sort of responsibility and chastity that's good and healthy and required of us even within the marriage. And NFP really is a promoter of that. NFP just being the fertility awareness and the decision-making process that's done in prayer with God by the couple is very promoting of that chastity. And one thing I just want to mention here is that I hear people a lot say, well, you can only use NFP for grave reasons. Well, what does grave mean to us? I mean, what do we kind of think of that word means? Like life and death or mortal sin or something like that. And I just want to mention that the original word that was in Humanae Vitae was juste, which actually translated directly from Latin to English is just. So it doesn't mean that the reasons don't need to be serious, but it's not like the woman has to be on death's door for a couple to kind of discern that they might need to postpone a pregnancy. That being said, the reason does need to be just, not selfish. So here I have a quote that says, "It is their duty," meaning the couple, "to make certain that their desire is not motivated by selfishness, but is in conformity with the generosity appropriate to responsible parenthood." So a quick story about that. Adam and I have 3 children, 7, 4, and 2. And very recently, we have, let's say, our 3rd child was a bombshell. He's crazy, crazy, crazy. He's very busy. He'll light up the room. He's so funny. His name is Paul. He's great. But I could lose 10 pounds chasing around the house after him all day long. And so I came to a point recently where I was just like, can we do another? I just am not sure. Like, will I be able to make it? Can I do it? And good old Father Braun said, you and Adam need to pray about it and decide. And I was really glad that he directed us back to our knees in prayer, because God really changed our hearts in the situation, and we felt much more open to the idea of another child after we really begged God to show us what he wanted for us. All of my reasons that seemed very just when I had written them down on paper started to kind of lose their luster after a while. So I think it's very important to emphasize that the discernment process must take place in a prayerful way, in a submissive mentality to God's will. It's also really important not to judge or condemn another's discernment process. We don't know what happens in someone else's house. We don't know what happens in someone else's head. And I think personally that it's really great if everyone keeps their nose in their own bedroom and they let other people discern with their spouse, God, and maybe a good director if that is what they need. their own family size. And it can be very misleading from the outside. Some people only have 2 children, and we have no idea what went behind that decision. They could have had 7 miscarriages. I read an article about that the other day. The woman had 7 miscarriages. She had 2 living here, 7 in heaven. Others might have 10, and we need to respect this as well. Our society tells us that you're crazy if you have 10 kids. How can you do that? Well, you know what? They did that because that was what they thought was right, and we don't need to judge their motives. The church has intentionally limited its definitions so that it challenges the couple to really enter into this discernment process together, so that you are praying about it and letting God, motivate your own conscience in this area. What responsible parenthood is not? Responsible parenthood meaning the discernment process. It is not an attitude that people who have lots of children can't control themselves. Okay, that's not responsible parenthood. If a family has a lot of kids, they may have plenty of self-control. On the other hand, they may not. Okay, so that's one thing. It's not a concern for overpopulation. You kind of brought that up. We're not going to overpopulate the world. Okay, it's going to be fine. Catholics have babies. It's going to be okay. It's not abortion. It's not taking a pill to get rid of a problem. It's not oops, uh-oh, or whatever that picture of that pill was. It's none of those things. It's also not having another child out of a sense of guilt. I hear a lot of women, NFP users, who are really conflicted a lot about this situation, and I just want to encourage people, have a child out of generosity. Have a child out of a sense of a call. Don't have a child out of a sense of guilt. This is not a good reason. Also, it's not have another child due to a lack of self-mastery. Back to that chastity thing that I mentioned before, couples in marriage need to have self-mastery. It should be a choice. You should be making a choice, not out of a lack of self-control that you can't keep your hands off each other and say, oh well, but a choice that you make out of a sense of mastery over the sexuality in your marriage.
The periods of abstinence, that are a natural part of natural family planning, are just as much a gift as the marital act itself. It causes you, I think a relationship between a man and a woman can become sort of dependent on the marital act. It can come that can be very, because that sort of blurs out a lot of the other issues that might be going on in the marriage, and allows you to not necessarily have to talk about some things that may be serious problems that you have, or maybe serious discernment or serious issues that you have to bring up. And so having those periods, again, in God's wisdom, He gave us these, He gave a woman cycles, so that if you're regulating your birth, that you're able to have that period of abstinence to focus on other areas of intimacy in your marriage. And so that can be really important.
So we just want to close with John Paul II and his kind of words on responsible parenthood. And he says, let them, husband and wife, thoughtfully take into account both their own welfare and that of their children, those already born and those which the future may bring. For this accounting, they need to reckon with both the material and the spiritual conditions of the times, as well as of their state in life. Finally, they should consult the interests of the family group, of temporal society, and of the church herself. Like Adam mentioned, we're one of the NFP teaching couples in our diocese. Our NFP courses are offered 3 times a year in English and twice in Spanish by Dan and Natalie Herrera. We do have, kind of on a case-by-case basis, another teacher who's willing to sort of volunteer. But if you want any more information for yourself, for someone you know, you can direct them to the website, www.ccli.org. And there, like, everything is posted. It's also posted on the cathedral website, right? Yes.
as far as I know.
Yes, it should be. So each course series, like Adam said, is 3 classes. They're each 3 hours. It's very comprehensive. You will leave knowing how to apply the method correctly. There's also postpartum and premenopause classes and books. Most of what we talked about today regarding NFP was based on just the generic rules of NFP. But of course, when you're transitioning out of having a baby or when you're entering into the postpartum year or into the premenopause years, the woman's body can start to do some pretty crazy things. And, you know, people may have questions on how to make that transition work while not taking a contraceptive. So that's something we can't get into right now, but if you have questions about that, feel free to ask me after class, or don't hesitate to sign up and we can offer you a course directly for that. Does anyone have any questions?
Yeah. How do you cultivate generosity in a materialistic, egocentric culture?
That's so good.
By using NFP and responsible parenthood. Honestly, it starts with the family. I mean, I think what I've really learned, we've come so far just in 8 years of marriage. Adam and I have been married about 8 years. 8 years and 3 kids, and it has changed our lives. I feel like having to use NFP keeps us communicating and talking all the time, and since we can talk and be vulnerable in that area, which is a really tough area for some people, it's easy to talk about all the other stuff. And because of that communication, over time, day to day, year to year, over time, we've learned to serve each other and to become less selfish with ourselves, with our lives. Adam goes to work every day and works really hard, and he's our only income, and he has to support a family of 5. And I stay home every day and have to take care of 3 kids, and we homeschool, and so that's hard sometimes. And things that I do now without even thinking about, like changing a diaper, I hated to change diapers when I first had Anthony, our firstborn. And now I just, oh, it's a diaper. I mean, I'm not thinking about myself the way I was 8 years ago, so I can't even imagine 10 years from now. And if our home does that, and your home does that, and your home does that, and your home does that, and then our kids all go out and they do it, that's a game changer. I mean, we can start in the home, and then as God works through the family, and we have awesome priests supporting us in our parishes, we can really make a difference. So,
And just being able to talk about it to people that ask questions, because the thing is, when you're happy in your marriage and there's clearly your faith and your marriage and all of those components of your life are in harmony with each other, people notice and they ask you questions day to day. I mean, at work, in social circles. And it's being a witness. It's telling why you do what you do, how you do what you do, and reel people in. That's it.